Assalamu alaikum, sunana Dr. Fatima Abubakar Aliyu. Yau za mu tattauna akan matsalan depression, matsalan damuwa, amma a harshen Turanci za mu tattauna shi. A yau ina tare da babban yayana Dr. Abubakar Umar, wanda Senior Registrar ne a Psychiatric a nan Federal Neuropsychiatric Hospital da ke Kaduna. Sa bismillah.
Thank you. We're going to talk about one of the most common mental health conditions around us, which is depression. It's a serious mental condition that affects millions of people worldwide. However, due to scarcity of information sometimes, it is often misunderstood. Now, we need to be clear between what is depression and what is sadness, because sometimes people tend to mix them up. Sometimes you can be sad because something has happened. Probably you've been bereaved, or you've lost some property or some finance or something that means a lot to you. So you can be, you can feel sad, and then that feeling of sadness lasts usually for a period of time. And then when you're able to regain all those things that you've lost, or if you've adjusted to the situation, you get back to your normal self. So that is not depression. Now, depression is a disease that is characterized by feelings of persistent low mood lasting for at least 2 weeks without any underlying cause. Then this is associated with loss of interest in activities that you used to find enjoyable, then accompanied by difficulty sleeping, poor appetite, low libido, and then there can be accompanying feelings of helplessness, hopelessness, and as it gets worse, you can start to have suicidal thoughts passively, which can worsen over time to thoughts about ending your life. Now, statistically, about one out of every 6 people have suffered depression or are going to suffer depression globally. This is a very significant number. If you look at it, 1 out of every 6 people. Now, it equates to about 60 million people suffering depression worldwide per year. Now, in Nigeria, we have up 1 to 3%. As the statistics for number of people, 1 to 3% for amount of people who suffer depression per year in Nigeria. What are the causes for depression? The causes of depression can be looked at from a biological, psychological, and social standpoint. Let's look at them one after the other.
Okay.
But on a biological level, it can be genetic. What are the causes for depression? The causes of depression can be looked at from a biological, psychological, and social standpoint. Let's look at them one after the other.
Okay.
But on a biological level, it can be genetic. If there's a family history of depression or another mental illness, that can predispose you to developing depression now or later in life.
So, sir, if someone has a family history of any mental illness,
Yes,
or even the depression per se,
yes,
so that person have a likelihood of having depression.
exactly. Having a family history of depression itself or
Any other.
any other mental illness predisposes you to developing depression.
Okay.
Again, there can be some hormonal changes in certain individuals, probably people undergoing menopause, or somebody who has just given birth, or somebody who is pregnant, or there can be neurotransmitter changes.
Okay. Those chemicals in the brain.
Yes, certain chemicals in the brain called neurotransmitters, especially serotonin. Serotonin is a neurotransmitter which, if there's an imbalance in its level, it can predispose one to depression. Now, that's on a biological level. Psychologically, being exposed to certain adverse childhood experiences,
Okay.
certain experiences during childhood, like physical abuse,
Okay.
emotional abuse, sexual abuse, or physical neglect, emotional neglect, or other household challenges while growing up. Those can serve as predisposing factors to
So individual.
depression in later life. Additionally, history of substance use can be a precursor to development
So
of depression.
people that use substance.
People who use substances
Okay.
can develop depression.
Okay.
Then, socially, like we've mentioned earlier, uh, being bereaved
Okay.
or having some relationship difficulties, such as having marital difficulties or problems with your relationship or being heartbroken, those are things that can lead to depression. Or somebody who has been defrauded of certain amount of money, or somebody who has lost someone very close. So those are social factors that can act as causes, predisposing or precipitating factors for development of depression.
Okay. So, if I understand, there are some biological causes, and then there are some psychological causes, and then the last one is the social
Social.
causes of
Yes.
depression.
Yes.
Okay, the biological, someone can inherit psychiatric illness, either depression or any.
Or any other
So
mental
which
illness.
would predispose that person to depression. Sir, what are the most common clinical presentation in our settings that people tend to present with when we have depression?
Okay. Sometimes you can feel sad
Okay.
for no reason,
Okay.
and then at the same time you feel you've lost interest in things that you used to enjoy doing. Then you
So
feel
for-
weak.
In that
In the
case,
morning, you're unable to get up from bed because you feel weak. You feel unmotivated to get up and do anything.
okay.
Some of those things that you used to carry out effortlessly, they become very difficult, very hectic for you to carry out. You start to lose sleep. Even when you get to sleep, it's not satisfying. You wake up very early, and then in the morning you don't feel refreshed. You want to go back to bed. You don't feel motivated. Sometimes you just have a headache. A lot of times you have these symptoms, but you don't even know how to describe it. So when
Exactly.
the only thing you can say is that you have a headache.
Headache.
Yes, but
until-
when you get to meet a professional,
the
they probe, yes, and then they're able
It
to
is
get to the
correct.
root of it.
Okay. So, sir, people that most of the times, people that are depressed, they don't know how to explain themselves. All what they feel is maybe they're not feeling well,
Yes.
recurrent headache, and then the headache is not pain. Most of the times they tend to say something crawling in their head, or they are feeling lightheadedness, or everything they explain is about the head. So, are there things that people that stay around them should be noticing, or when they see they are supposed to, get them help?
Now, when you start to have some of these experiences, or when somebody around you uh, notices, when you notice that somebody around you is exhibiting some of these symptoms, it's important for you to try to get help. There are professionals. There are
Do people with depression present with abnormal experiences, like seeing things other people cannot see, and
Yeah.
other things?
Yes, that's hallucination, right?
Yes.
So people who have depressive illness can have abnormal experiences,
Okay.
like seeing things that nobody else can see. That's visual hallucination, or hearing voices or things that nobody else can hear. That's auditory hallucination.
Yes.
Or the other forms of hallucinations, gustatory, tactile,
Okay.
or olfactory.
Okay, to just
Also, yes, also they can have some unusual beliefs that are not real, that are false, like believing that they are guilty of something they did in the past is responsible for
What is happening.
what is happening to them currently. So these together, the hallucinations, the abnormal beliefs, which we call delusions, form what we call psychosis. So you can have depression with psychosis.